evening, ladies and gentlemen. Tonight, I would like your undivided attention. I would like to discuss with you a subject close to my heart, fear. More specifically, dental fear. I was at the dentist office one time and the anesthetic was just wearing...
What are you doing, Eric?
Starting the podcast.
Without me?
Yeah, well...
Without me? Eric, you are going to be in so much trouble, I cannot believe you.
Now that's scary.
Listen up, everybody. Yeah, that means you. A healthy mouth, healthy body. What you gonna do? Don't roll the dice, any old advice. No. Go to the source, straight from the mouth. Straight from the mouth, from the ADA. Straight from the mouth. Here's what the dentists say. Straight from the mouth.
So, all joking aside, there are two main reasons that people are scared to go to the dentist. The known and the unknown. Some people may have had a bad experience in the past, and others who have never been to the dentist may just be afraid because they don't know what to expect.
But it's important to not let your anxiety get in the way of your oral health. It's important also to find a dentist that you can trust and you can discuss your fears with, and maybe he can help you ease that anxiety for you.
Mm-hmm. And so that's why we're going to focus this podcast on different reasons that people may be anxious to go to the dentist and talk about some ways to help ease that anxiety.
Straight from the mouth.
There are many reasons why people are afraid of the dentist. Some reasons may include the needle and the pain that causes. Maybe it's the sound of the drill. Or maybe it's the water used during some dental procedures that may make a patient feel like they're drowning.
So let's take these one at a time. First, needles. Okay, anesthetics prevent pain during surgical procedures like extractions, root canals, and filling cavities. Now those don't really sound like surgical procedures, but they are. We're cutting into gums and teeth.
Nerves signal pain to the brain, and dentists use anesthetic to block these nerve signals. But some people are really afraid of needles.
And there are some ways to deal with needle fear. You can ask your dentist to help make it more comfortable for you. You can ask if there's a gel that can be rubbed onto the area before the needle is inserted.
You can also ask the dental office staff to keep the instruments out of your line of sight. And when the dentist comes in for the injection, just divert your eyes. Or if you feel more comfortable, wear an eye mask.
You can also use self-relaxation techniques like meditation or visualizing a place that you'd rather be, like Hawaii.
Distracting yourself with an MP3 player with music or soothing sounds may be a way to go. Or, if that doesn't work, you want to talk to your dentist about using something like nitrous oxide or laughing gas or other sedation options.
Straight from the mouth.
The next fear we're going to discuss is the fear of the dental drill. You'll see that the dental drill is a very important instrument for most dental procedures. You'll see that the sound it makes actually comes from the air that's used to spin the burr, or the cutting part of the drill. So the sound is actually much larger than the motion that the drill is making. Some dentists will actually use an electric drill. These tend to be much quieter and might help calm your fears. Some dentists won't mind if you bring your MP3 player. Just make sure you select earbuds that will stay in your ear and don't play your music so loud that you can't communicate with your dentist.
Straight from the mouth.
So now for the final fear, fear of drowning or choking. Dentists use water to either keep the tooth cool while the drill is working or to rinse the tooth. That makes the water go to the back of your mouth sometimes, and for some people, it can make it difficult to breathe or cause the feeling of choking. But there are some things that we can do to deal with that feeling. First, you can discuss this with your dentist. Let them know that you don't like the feeling of the water in the back of your mouth and that it causes difficulty breathing. Also, set up a signal with your dentist so that when you're laying back in the chair, you can raise your hand and let him know that you're having difficulty breathing and they can use the suction to take care of that water. You can also ask your dentist to use a dental dam. This is a thin piece of rubber that goes over your tooth, seals your tooth so that water doesn't go into your mouth. There's also an exercise you can do at home before your dental appointment. The first thing is to try just swallowing with your mouth open. After you've mastered that, take some water in your mouth and just hold it. Then practice breathing without swallowing the water.
Your dentist wants your appointment to be as comfortable as possible, so discuss ways with him to ease your anxiety.
But that's about it for this podcast. And remember, we love hearing your feedback and your comments, so please continue sending them to podcast@ada.org.
And thanks for watching, and keep watching the site for further episodes of
Straight from the Mouth.
Listen up, everybody. Yeah, that means you. A healthy mouth, healthy body. What you gonna do? Don't roll the dice. Any old advice.
So tell me, what are you afraid of?
heights, birds, shower curtains, knife-wielding maniacs. You?
You sometimes.
Straight from the mouth.